Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Dermatitis Herpetiformis. This is a chronic skin condition characterized by intensely itching, blistering rashes. The disease affects predominantly males, most often in the third and fourth decades of life. It is considered the skin manifestation of celiac disease and is caused by an autoimmune reaction to gluten, a protein found in wheat, barley, and rye. Dermatitis herpetiformis is almost always associated with celiac disease. However, there are rare cases where individual presents with dermatitis herpetiformis-like symptoms without evidence of intestinal damage typical of celiac disease. The key features of dermatitis herpetiformis: rash appearance, cluster of small red bumps and blisters, often on the elbows, knees, buttocks, back, and scalp. Itching and burning. The rash is typically extremely itchy and may have a burning sensation. Symmetry. The rash often appears symmetrically on both sides of the body. Blisters. This can rupture easily, can leave behind dark or light spot when heat. So we have rash, itching and burning. Symmetry. It often appears symmetrical in both sides of the body. There are also blisters. They can rupture easily and may leave behind dark or light spot when heat. So blisters are also a key feature of dermatitis herpetiformis: rash, itching, and blister, and symmetrical appearance. Okay, this is the image has been taken from Robbins Cotton Kumar, Dermatitis Herpetiformis. Okay, we got that. Lesion consists of groups of intact eroded erythematous blister. Seen here on elbows and arms, we have blisters here. Selective deposition of IgA antibody at the tip of dermal papilla is characteristic. So here we get IgA deposition. Blisters are associated with accumulation of neutrophils, microabscess at the tip of dermal papilla here. This is the dermal papilla here, and here will be microabscess formation. So what are the causes and diagnosis? Causes: autoimmune reaction. The body's immune system mistakenly attacks the skin in response to gluten ingestion. Celiac disease. Almost all individuals with dermatitis herpetiformis have underlying celiac disease, though some may not have significant gastrointestinal symptoms. Diagnosis: skin biopsy. Biopsy of the unaffected skin near the rash to detect IgA deposits. Blood test to check for antibodies like anti-tissue transglutaminase and anti-endomysial antibodies associated with celiac disease. So diagnosis by skin biopsy, blood test to check antibodies, anti-tissue transglutaminase and anti-endomysial antibodies. Pathogenesis. The association of dermatitis herpetiformis with celiac disease provides a clue to its pathogenesis. Genetically predisposed individual develop IgA antibodies to dietary gluten derived from wheat protein gliadin. We also rye, barley produce the same protein. The antibodies cross-react with reticulin, a component of the anchoring fibrils that tether the epidermal basement membrane to the superficial dermis. The resultant injury and inflammation produce a subepidermal blister, in some cases with dermatitis herpetiformis and gluten-sensitive enteropathy. Both disorders respond to gluten-free diet. So intestinal presentation is always present, but rare occasion. Intestinal presentation may not present. Fibrin and neutrophil accumulate selectively at the tips of dermal papilla, forming small microabscesses. The basal cells overlying these microabscesses show vacuolization and focal dermoepidermal separation that ultimately coalesce to form true subepidermal blister. By direct immunofluorescence, dermatitis herpetiformis shows discontinuous granular deposits of IgA that selectively localize at the tips of the dermal papilla. Treatment. What is the treatment? Gluten-free diet, the cornerstone of treatment as it addresses the root cause. That is, the gluten-free diet is the treatment. Dapsone, an antibiotic that has anti-inflammatory properties to reduce symptoms, but it does not treat the underlying cause. Monitoring, regular follow-up with healthcare provider as dermatitis herpetiformis can indicate increased risk of other autoimmune diseases. So you have to know that if we have one autoimmune disease, we have another autoimmune disease may happen. Like a person with dermatitis herpetiformis may have also hypothyroidism, may have Graves' disease. And that's all about the dermatitis herpetiformis, a skin manifestation of celiac disease. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel and please subscribe me. Have a nice, wonderful and blessed day. Bye now.